Hello. Today we will talk about drugs used in coagulation disorder. The anticoagulant drugs inhibit either the action of the coagulation factors, for example, heparin, or interfere with the synthesis of the coagulation factors, for example, vitamin K antagonists such as warfarin. Now we will begin with heparin and related drugs. These drugs mainly act by binding to naturally blood compound called antithrombin 3, that in turn inhibit factor 2 thrombin and factor 10 but with different selectivity. Heparin are of two types, the unfractionated and low molecular weight such as enoxaparin, dalteparin, anything with parin suffix. The unfractionated mainly act more on thrombin, while the low molecular act more on factor 10. Low molecular have been designated so it will have longer half-life, less risk of bleeding, more predictable action so that can be given for inpatient and outpatient. Unfractionated need to be monitored by APTT. Heparin half-life is about 1 hour. You can remember it by the word heparine, which stand for half-life elimination period around roughly I hour normally. Excretion of these drugs by kidney, you can remember it by the suffix ren, renal, in the heparin. Side effect of any drug act on coagulation or platelet is bleeding, but heparin has something else which is heparin-induced thrombocytopenia, which is more with unfractionated. So now you can tell everything bad is the unfractionated one. Warfarin, vitamin K antagonist that inhibits the synthesis of factor 1972. If you remember vitamin K real, since it inhibits synthesis, so means the onset will be delayed because the already circulating factor can work for days. So warfarin need 3 to 5 days to work, so that's why for patients we give low molecular weight heparin and warfarin together, then after 3 to 5 days we remove low molecular. For any anticoagulant, as you remember, used for DVT and orthosurgeries, always heparin is the first choice, but for long-term we use warfarin since it's orally. Warfarin can pass the placenta, so it's contraindicated in pregnancy. And there is the special uses depending on the characteristics that we have talked about. Direct thrombin inhibitors, bivalirudin, argatrobin, dabigatran. These can be used with those who cannot tolerate heparin because of heparin-induced thrombocytopenia. Dabigatran and warfarin is the only important anticoagulant used orally. Direct factor 10 inhibitors, apixaban, edoxaban, the letter X indicator factor 10, since inhibit factor 10, so there is no need for monitoring. Thank you very much. Don't forget to like and follow.